Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hello and welcome back to the Healthcare Algorhythm, where we explore the intersection of care delivery, healthcare operations, and technology. And our guest today sees that through the lens of one of the toughest challenges in clinical care, and that is getting better after a hospital stay. Antonio Johnson is a doctor of physical therapy and an MBA-trained healthcare executive with over 20 years of leadership experience across post-acute care, rehabilitation, and skilled nursing. He's led multi-site operations, including oversight of dozens of facilities, hundreds of clinicians, and full responsibility for organizations generating north of $30 million in annual revenue. So, Antonio, thank you for being here today.
Absolutely. Thank you very much for having me.
My pleasure. Now, on this show, we like to focus on innovation, and ideally that represents new ways of thinking about unsolved problems. So when you look across skilled nursing and rehab today, where do you see the biggest operational pressures compared to even 5 or 10 years ago?
Well, William, I think one of the largest operational pressures comes down to supply and demand in terms of clinicians, because we're seeing a shortage of clinicians overall in terms of PTs, OTs, SLPs, and assistants. But the demand continues to grow in terms of, the baby boomer generation is, becoming more and more prevalent within the setting. So as that demand continues to rise, the supply of clinicians just isn't quite meeting it yet. So we're always trying to think of alternative ways to make sure we're still providing outstanding patient care and meeting the objectives of the staff who are delivering that care as well in terms of retention.
Now, as a doctor of physical therapy, I'm sure you have a very robust experience in clinical care. Maybe even you started as a clinician. So you've seen it from the front lines to now the C-suite. Where's the kink in the bottleneck? Is it that are less people going into it, or is it just the growth in the need is outstripping the available supply of doctors or new graduates coming out of training programs?
So it's a combination of both. We're definitely seeing a shortage of individuals applying to allied health professional schools post-graduation, because all programs now are usually either at a master's or a doctorate level. But then whenever you think of the rise in the population that requires care, in addition to the administrative burden that we're seeing as it relates to value-based care, the delivery expectations of the insurance companies and so forth to get essentially a patient transition in a short period of time at a particular level of independence, it's a lot of pressures that are going on simultaneously that we're trying to address within the industry.
Got it. Okay. So maybe even just kind of take me back to the beginning of when someone is thinking about a career in one of these allied services. Let's just kind of stick in the rehab PT space. What are they thinking about as they're starting to approach the job market? What does that look like to them?
I think individuals who are interested in going into this field really have to understand that you have to have a caring component to what you want to do. That's one of the reasons why I went into physical therapy was the care piece. I wanted to see the people who I was taking care of getting better and improving. And if you don't have that innate ability within you, that tends to defeat your level of success as it relates to the clinician. But if you are someone who likes to see people improve and get better, there's definitely plenty of opportunities as it relates to becoming either a therapist or an assistant.
You mentioned there that more clinicians are coming in these fields are either master's or doctorate level. That's new to me. Has that changed over time? Is it because the regulatory requirements are increasing, or just the expectations of the level of training has gotten a little bit more sophisticated?
So the level of training has definitely increased and become more specific over the past 15 to 20 years in terms of the educational requirements. But one of the other elements that you're dealing with in terms of individuals not necessarily going into the profession is at a master or doctorate level education comes a considerable expense in terms
Sure.
of college tuition and so forth. A lot of people are weighing, is it worth the benefit to go ahead and become a therapist compared to the reimbursement landscape as well as the compensation landscape once they graduate from school.
So now we're getting somewhere because this is a trend in really across higher education. So is it the cost of the education is starting to outpace the growth in the reimbursement or the compensation opportunity?
Yes, that's the same scenario that's going on within the industry right
Wow.
now.
But yet the demand is increasing, right? So you would
The
in a
demand is
normal
increasing.
environment, right? The demand increases, your compensation increases. So what gives?
That, William, that's the breaking point right now is figuring out where exactly is that sweet spot because you want to compensate clinicians accordingly, as it relates to their experience and the care that they're providing. But you're also looking at whenever we're delivering the care, what type of reimbursement are we getting, not only from a Medicare perspective, but also the managed care organizations. And if we're meeting the outcomes and clinical expectations that are exceedingly, above state and national averages, we should likely see an accompanying increase in terms of reimbursement because we're saving money.
Right, right. Yeah, healthcare can be an unfortunately odd profession in that the better you do, then they expect, okay, well then you can do it for less now,
Yes,
right?
that's the state of value-based care right now,
Yeah,
essentially.
right. Well, so then you've had to see this both as a clinician and an executive. Can you give a sense of what's worked or what can work? Or where have you seen this operate best and where who struggles the most with it?
So, in trying to bridge the gap, particularly from a staffing perspective, we're always getting feedback and recommendations from our frontline team on how can we make your responsibilities more efficient
Okay.
and make you more successful in what you're trying to do, especially as it relates to, the administrative burden that I previously mentioned with all of the documentation update requirements for the managed care insurance organizations. So, a lot of times we have collaborated with both the managed care insurance organizations as well as our EMR providers to figure out whenever our clinicians are documenting what are the specific areas you're looking into and what is the cadence that you would like to see those elements and trying to integrate that into the EMR that way, whenever the clinicians are working with the patients in delivering exceptional care, the managed care organizations are also obtaining the information that they need on a weekly basis related to updates. So it kind of bridges that gap in terms of what both sides need to make things work.
Now, do you see, you mentioned EMRs, and there's a lot of talk about innovation in the EMR space. Although, one of the things that's a little bit challenging is EMRs, I don't think most people recognize, they're really built for like coding and billing. They're not really built to make care coordination much better generally, right?
Correct.
And they're certainly not built to make clinicians' lives easier. So, are you seeing any evolution in the EMRs that are making this easier, or are you just finding?
In a lot of cases right now, they are workarounds where you may have to have a customized library within your EMR. But I think a lot of EMR companies are also looking at the challenges that we're all faced with in the healthcare industry on how exactly do we make delivery of care easier for the clinicians and with either, AI integration in a lot of the platforms looking into, how exactly clinicians are documenting and how to make that easier for them based on the patient condition. I think those are definitely some innovative ideas that are starting to come about in a lot of the EMRs today.
Okay. And I mean, can you think of any specific examples in your experience where you've seen that start to work a little bit better, whether it's around, coding the diagnoses or the care that you're providing or just reducing some of the administrative burden?
Yeah, in terms of reducing the administrative burden, I know with one of the EMRs that we've used within our organization, they were able to incorporate a lot of the generalized managed care insurance updates into our custom library for us, which has definitely worked. And then from a coding perspective, I've also worked with some other EMR vendors who are using AI to essentially scan the document, determine whether or not the medical and treatment diagnoses are going to optimize your reimbursement levels based on, the clinical presentation of the patient and ensuring its accuracy. And if there's any issues there, it'll trigger alerts in order for not only the therapists, but also the reimbursement team to look into what corrections do we need to make here based on the care that we're delivering.
Oh, so does that mean, like, if someone comes in right from the beginning, you could scan their notes already, like, what already has occurred
Yes.
and
Similar to
understand.
like a OCR type AI component. Yes.
Oh, okay, okay, wow, that sounds pretty good. And are you in terms of adoption, right? Because I feel like a lot of times I see there's all these great technologies out there. Technology is not the problem. Usually, it has to do more with the adoption or the ability to adopt these things. So, you've
Yes.
seen all time. Imagine if you've been over 30 plus facilities, you've seen multiple different types of teams and what types of teams are more ready to adopt newer technologies or innovative technologies as what are the characteristics of those in your world?
So in my world, and we're all creatures of habit and we don't necessarily like change.
Mhm.
So we found that a lot of the younger generations tend to adapt to it rather quickly and are more open to, yes, I'll definitely give this a try because it's going to make my job a lot easier. Versus myself, I'm a Generation Xer. So I may not necessarily have that same level of enthusiasm, but I'm going to do it to make sure that, hey, this actually is easier, but I'm resistant to change. So it's one of those similar situations.
Well, and I think that ties to something that have mentioned I've seen in your work where, it's not just about operations, it's about culture, right? Culture is what
Exactly.
and dry or and a culture of innovation sets people up more for success for these types of things. So, it seems like you've been focused on culture. Give me a little bit of a sense of how you build that type of a good culture, a positive culture, one that's open, that's able to adapt and bring on these types of changes.
So a great example to the culture point, William, is whenever we did try to adapt some of these changes within the EMR system, and it's, pretty technologically advanced, we have productivity expectations in terms of operations
Hmm.
and efficiency. So whenever we decided to adapt a new EMR system, I knew while working with my leaders that in order for us to do this, there's going to be a learning curve. So since there's going to be a learning curve, we are going to have to be a little more flexible in terms of our productivity expectations in order to give the team enough time to pick up on this. And the team really bought into that, which increased their overall engagement to want to learn how to use it even more.
So who was on the other side of that equation? I guess was it a health system that you were working with or what,
So the other side of the equation, of course, were our clinicians providing direct care. And whenever we brought the opportunity to them to say, hey, this is a way that we potentially can make your job a lot easier, there was some opposition, which is, to be expected. But whenever we described our approach, because we're big on transparency, that's whenever we were able to get greater buy-in in terms of implementing that new system.
Got it, okay. And, you kinda brought up this concept of not just for, younger people are more adept to change, as you get a little bit older, you get set in your habits, this change increases the cognitive load of the stuff that you have to do, and often that leads to the concept of burnout, and
Yes.
so I think that's something that we all struggle with and are hopeful that some of these newer things are gonna help reduce burnout. So you've again, as someone who's seen this as both a clinician and executive, what gets someone there in the rehab skilled kind of space? What gets them to where they come in and really want to help somebody, but they get to the burnout level? And how can we prevent that?
I think it's continuing to have open lines of communication with your leaders and with your team at the business unit level. A lot of times we miss out on that. One of the things that we touched on at the beginning was with the demand being so high, we have clinicians who are treating a greater number of patients now compared to before. 10 years ago, they may have been treating 7 to 8 patients a day on average. That number in some cases is almost double
Wow.
based on what's expected in terms of patient care across the different providers and payers. So we have to figure out, how are we connecting with our team members on a daily and weekly basis to check in on them because burnout is very real. And whenever that's occurring, we try to work with our teams to put strategies in place, whether it be the use of technology or adapting technology and making things easier that way,
Hmm.
or figuring out additional ways to bring in more resources to help as well because retention is so important in today's industry and great quality clinicians are hard to find. So whenever you do have them, you have to do everything that's necessary to make sure you keep them there without them being burned out.
Absolutely, because you mentioned previously just the cost of the education for the individual themselves is high, but then even once you bring someone into a team, that they're just beginning their training. I mean, we've a good friend many years ago once told me when he completed his training is that his supervisor or his attending asked him what he thought. He's like, "Well, I feel like I've just now learned how to become a doctor." And that
Yes,
that so when we bring people into our organizations, we invest a lot in them, and every time we lose one of those people, it's not just filling another name on a spreadsheet. It's actually we have to go and bring someone in and retrain them, even if it's just simply organizational training. So, again, that's one of these areas where hopefully technology can start to reduce some of the unnecessary burdensome things that people are dealing with so that they can, it might be easier to take care of, say, 14 patients if the rest of the stuff is taken care of, right? If you're not having to do all the
agreed.
burden documentation. Have you found, or any of you, or have you seen any of allied health professionals using AI scribes yet for their? I know that's becoming more and more popular with on the medical side with clinicians, doctors, and nurse practitioners and such. But have you got into that at all? Have you seen that in action?
So, yes, some of the EMR systems do have AI transcription capabilities. It's in its infancy stages, but we've had an opportunity through different pilots of the new EMR systems and the rollouts later this year to utilize those components. And I think that's going to be a very useful tool from a technology perspective going forward for clinicians.
Do you find that the people are receptive to it?
Yes, they have been so far. I mean, it's different if you haven't been used to using a transcription device previously, but I think once you've had some practice, just like anything else, you start to improve upon those skills and it becomes more easier to adapt to for use.
So it seems like still really the biggest pain point you're seeing right now is really around the workforce and the clinicians and the clinical availability. As you look out kind of in the years to come, the next 3 to 5 years, is there hope that there's solutions out there to train that? Are more schools opening up, or can technology, whether it be in the terms of I don't know, robotics involved in getting people healing faster? Are you seeing anything like that out in the space that can kind of help reduce the pressures on the so-called human workforce?
I think it's probably threefold as it relates to the solution. The first piece is there are, some robotic components out on the market that are being considered, which can definitely help with some aspects of delivering patient care. I think a second component is whenever you consider what's going on in the reimbursement landscape and advocacy on the federal and state level in terms of our representatives looking into, hey, if this is the supply challenge that we're dealing with right now, how do we make access a lot easier for some of these programs in order to, have more clinicians available to work with the patients and so forth. And the other piece is working directly with, the local high schools, colleges, and universities as well, just to kind of let them know that long term care and skilled nursing is another avenue that you can go into because a lot of times our industry can be the forgotten industry when considering, hospital systems and acute care. So it's definitely a lot of opportunities within our industry as well.
Well, sure, and as you mentioned, the population that you serve is only growing in number, and our the patient population is getting older and more complex.
Yes.
And so as you can understand why it takes a higher level of skill. So what about the field made you transition from the clinician to the executive world?
So I love patient care to start out. That's why I went into physical therapy. But whenever, probably maybe 3 years after practicing, I kind of decided to myself, hey, what does management look like? And how can I continue to have an impact not only on what's going on with patient care, but also successful operations for an organization? And that's what led me to transition into administrative and management type work.
Okay, and what do you like the most about that?
I think it's still making an impact. I still like the fact that, I have the opportunity to talk with clinicians and also talk to patients and their families to see how everything is going on that frontline level. And then whenever you look at that and translate it into what are your clinical outcomes, what are your financial outcomes, and are they sustained success? that drives me. And just working together with all of those stakeholders to make sure that we're delivering outstanding service, which is still a priority for me.
So I always like to bring it back to patients kind of towards the end. And I would say if you're a patient, to those of us who don't practice in this, but may someday need some sort of rehabilitation, what is it? What is exciting out there? What do you know, in terms of the developments or the things that are going to make allow people to recover their functionality, their independence a lot better now and then in like because of these emerging technologies than perhaps 5, 10 years ago?
Yes. So with evidence-based practice and technology, everything is advancing, at the speed of light almost on an annual basis. Perfect example, my parents just recently had knee surgeries
Okay.
and they were total knee surgeries, and their recovery time was a lot less than what it would look like for a total knee surgery 5, 10 years ago. So I think that's an exciting opportunity as it relates to surgical advancements and technology, and also what's available to the therapist, not only now, but what everything is going to look like in 3 to 5 years in terms of faster recovery time.
Yeah, so sure, there's definitely some advances in the technology that the surgeons are using, right? The surgeons
Yes.
are less and less invasive, and it's amazing to see just in over the span of my career how knee surgery used to have you in the hospital 3 days or at least, right? You
Yes.
know, now you're out the next day in some cases, right? And I think that just transitions people off. I guess another thing too, I don't know how much you focus on this because if I guess if you're seeing them in the post-acute world, you don't get to generally meet folks ahead of time, but I know there's a lot of excitement and interest around things like prehabilitation. So do you have any experience in thinking about that or, what are ways to kind of catch people earlier in the process to get them prehab so that they have a better rehab?
Yeah, William, a lot of times with that, and prehab is very effective, and research clearly shows that. But a lot of times, the general population isn't necessarily aware of prehab. So it comes down to, making sure that we continue to educate the general population, whether that be through blogs, materials that are provided whenever they go to physician office appointments and so forth, to let them know if you have this particular condition or you're trending towards this particular condition. There are preventative measures that you can do, before you get to that point, that are going to help you moving forward in the future.
Is there one thing you've seen specifically that patients have done that you notice, yeah, these are the ones who I know who are going to do better?
Yeah, so usually, of course, you're dealing with patients who don't have as many comorbidities,
Mhm.
and also those who are going to be more compliant with a prehab program. I'll kind of use myself as a personal example. Whenever my mother was going to have her total knee surgery, I let her know, hey, these are the things that you want to do ahead of time as it relates to, your lower extremity strengthening. Make sure you do it. And this is the frequency that you need to do it per week. And she actually followed up, and she could see the results from that after surgery, to where even whenever she went to outpatient physical therapy, her PT at that time was like, you're doing outstanding. What did you do, prior to surgery? And she kind of explained her prehab program. And she was like, oh, okay, that's great. You can see the results.
And, I think there's something in that we all have a role to play in making or addressing these workforce shortages, right? And I think to the extent that we as a community, as patients, can kind of take a little bit more ownership of our care, right? And use all the tools that we
Yes.
have available to us right now, from wearables to blogs to all the information that's out there to make ourselves better patients, then that makes probably puts less stress, I would guess, on people in your field that
It
you are.
does every
Yeah.
time.
Yeah, well, you know what? We work in a very difficult field, but there's something that generally most of us, at least those who've been in it as long as you and I have, right, that keeps us coming back and that we kind of really love about it. So, I always often like to kind of close with, what's your why? What do you love about what you do and what keeps you in the field?
My why, William, is continuing to make an impact in the world, particularly as it relates to healthcare. Whenever, and you've been around the business long enough to know as well, a lot of times there's situations where patients and their families aren't happy. And usually in those cases, you have to find out, okay, what did we do wrong? So my why is making sure we continue to take accountability on areas where we may have made some mistakes, and figuring out what we need to do to make it better. not only just better for the patients and families, but also going back to the staffing shortages, making it better for our staff and
Right.
everybody who's involved. And if you're, bridging and bringing together all of those different stakeholders, that equates to my why of making sure I'm having a positive impact on those I'm interacting with.
Well, that's fantastic because, one of the things, as I alluded to earlier, is that, our population is getting older, but it's no fun getting older if you don't maintain your functional ability and particularly your independence. And I know you operate at that space every day trying to restore that for people. So I'm glad there's people out there doing what you do. I'll probably need you one day. So hopefully it's not for a little while. But Antonio, thank you so much for joining me today. It's been a fun conversation.
Absolutely, William. Thank you for having me.
All right. And thank you all for listening to us on the Healthcare Algorithm today. Hey, if you're ready for surgery, get out there and do your prehab. Okay. Make Antonio's job easier. And until then, we'll see you on the next,
definitely.
we'll see you on the next episode. Till then, be well. Take care.